What happens to your prostate when you masturbate after 60? The shocking truth no one told you. Did you know that men over 60 who ejaculate more than 21 times a month may reduce their risk of prostate cancer by up to 33%? But at the same time, if done incorrectly, it could actually damage your skin, nerves, and emotional health. Before we dive in, make sure to hit like, share, and subscribe and drop a comment. Do you think masturbation after 60 is healthy or harmful? Let's start a conversation. Introduction. Why is it that even in 2025, talking about masturbation, especially after age 60, still feels like breaking a taboo? Society has painted a picture that older men should outgrow this need, as if self-pleasure is something only teenagers do. For decades, whispers of guilt, religious fear, and outdated medical beliefs have convinced many men that masturbation is either embarrassing, unnecessary, or even dangerous. But here's the truth I want you to hold on to: your body doesn't stop needing care, intimacy, or stimulation just because you turned 60. In fact, this stage of life might be the most important time to pay attention to your sexual health. Masturbation after 60 is neither shameful nor irrelevant. It's a natural function like stretching your muscles, exercising your lungs, or brushing your teeth. What changes with age is how your body responds and how you need to approach it. And today, we're going to uncover it all. The 5 powerful benefits of masturbation after 60. The 5 hidden risks if it's done incorrectly. And how to turn this private act into a gentle, restorative health ritual. So stick with me. What you hear in the next 20 minutes may change how you look at your body and your prostate health forever. Body. Shocking question before body. If I told you that masturbation could either act as a natural medicine for your prostate or slowly sabotage your intimate life, which side would you believe? Before we break this down, hit like, share, and subscribe if you think men over 60 deserve real, science-backed conversations about sexual health. Also, drop a comment: should doctors talk more openly about this topic? Part 1. The 5 proven benefits of masturbation after 60. 1. It's exercise for your penis. Think of your penis as a muscle-powered organ. Just like your arms or legs, it relies on regular blood flow and stimulation to stay strong. Each erection is essentially a mini workout for your erectile tissue. Without regular erections, older men risk a condition called penile fibrosis, where tissues stiffen and lose elasticity. That's why some men after 60 notice weaker erections. Masturbation in moderation helps oxygenate and stretch those tissues, keeping your erections firm and responsive when you need them. Personal insight: I often compare it to keeping oil in an old engine. If you let it sit for months, things start to rust and stick. But with gentle movement, everything stays functional. 2. It protects your prostate. This one shocks many men. A landmark Harvard study found that men who ejaculated more than 21 times per month lowered their risk of prostate cancer by up to 33%. Why? Because the prostate acts like a storage center for seminal fluid. Without regular flushing, stagnant secretions can build up, causing inflammation, infection, or even DNA mutations. Ejaculation is like taking out the trash: ignore it, and the waste piles up. Real-life example: I once spoke with a widowed man in his late 60s who believed abstinence was healthier. After years of avoiding release, he developed chronic prostatitis. His urologist later explained that regular ejaculation could have helped reduce his prostate irritation. 3. It strengthens pelvic floor muscles. We often hear about Kegel exercises for women, but men need them just as much. Every orgasm involves rhythmic contractions of the pubicoccygeus muscle, which is the foundation of your pelvic floor. Benefits include stronger, longer-lasting erections, better bladder control, less leakage or dribbling, more control over ejaculation. Science backing: a study published in BJU International showed that men who trained their pelvic floor through orgasm and exercises had improved erectile function within 3 months. 4. It reduces stress and improves sleep. Aging often comes with insomnia, higher cortisol, and anxiety. But ejaculation triggers the release of oxytocin and prolactin, calming hormones that reduce stress and promote sleep. This isn't just relaxation. research from the Journal of Sexual Medicine shows post-orgasm hormone release directly improves sleep quality and lowers blood pressure. Personal opinion: instead of reaching for another sleeping pill, many older men could benefit more from understanding how their body naturally resets through intimacy. 5. It keeps your libido and brain pathways active. Your largest sex organ isn't between your legs, it's your brain. Neural circuits that handle arousal and pleasure fade if they're unused. Masturbation keeps these pathways alive, preventing loss of desire and helping you remain sexually responsive. Example: many men who stop intimacy for years report feeling numb, but with gradual reintroduction of stimulation, even just solo, they often notice libido and mood returning. Part 2: The 5 Hidden Risks of Masturbation After 60. Now let's flip the coin. Masturbation can be healthy, but only if done mindfully. Here are the dangers if it becomes excessive, rough, or emotionally misplaced. 1. Risk of social withdrawal. Some men, especially widowed or divorced, may retreat into masturbation as a substitute for intimacy. Over time, this may worsen loneliness, depression, and lack of connection. Masturbation should support your relationships, not replace them. 2. Skin irritation and micro-tears. Aging skin is thinner and more delicate. Aggressive masturbation without lubricant can cause abrasions, burning, and inflammation. Solution: always use a water-based lubricant. Think slow and mindful, not fast and rough. 3. Desensitization over time. Using the same grip, rhythm, or porn-based stimulation can train your brain to only respond to that one pattern. This can cause partnered sex to feel unsatisfying. Tip: vary your technique, avoid over-reliance on porn, and let your imagination or emotional connection guide you. 4. It can hide medical problems. If you can get an erection alone but not with a partner, it may signal early erectile dysfunction, circulatory issues, low testosterone, psychological stress. Masturbation works, but it can mask bigger problems. Always check with a doctor if patterns change. 5. It can become emotional avoidance. Like alcohol or overeating, masturbation can become a coping mechanism for boredom, stress, or sadness. Instead of replacing real coping strategies like movement, connection, or meditation, it becomes a band-aid. Personal opinion: if masturbation is your only way of calming down, it's time to add healthier tools to your emotional toolbox. Part 3: Signs you should see a doctor. Here are 5 red flags you should never ignore. 1. Erections only during masturbation, not with a partner. 2. Pain or pressure during ejaculation. 3. Blood in semen or urine. 4. Libido completely vanished for months. 5. Loss of sensitivity or numbness. These don't mean you did something wrong, they're simply your body asking for medical attention. Part 4: Turning masturbation into a health ritual. Instead of seeing it as a guilty habit, think of it as self-care. 1. Best time: mornings or after a warm shower. 2. Create a calm, intentional setting, not rushed. 3. Always use lubrication. 4. Focus on sensation and rhythm, not speed. 5. Combine with pelvic floor engagement for maximum health benefit. This way, masturbation becomes part of a balanced lifestyle, just like stretching or meditation. Conclusion. Surprising stat before conclusion. Did you know that by age 70, up to 50% of men struggle with some form of erectile dysfunction, yet many could improve their function simply by maintaining regular, mindful stimulation? Before we wrap up, hit like, share, and subscribe and comment below. Do you think masturbation after 60 should be openly discussed by doctors or kept private? Final takeaway. Masturbation after 60 isn't about shame, weakness, or immaturity. It's about understanding your body and using this natural act as a tool for prostate protection, better erections, stronger pelvic floor, reduced stress, sustained desire. But at the same time, it comes with risks if it replaces human connection, if it's done aggressively, or if it masks deeper medical problems. Balance is key. Listen to your body, watch for warning signs, and don't hesitate to ask for medical help when needed. Because aging doesn't mean losing your vitality. It means learning how to care for yourself with wisdom, awareness, and dignity.